Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Breathing is something that we necessarily do and typically without needing to think much about it. Now that's a good thing because obviously if we don't breathe, that's a problem, and the body really can't go very long without oxygen. You know, some people can hold their breath for a few minutes, but that's about as far as it goes. However, most of us are all pretty busy, so we don't necessarily have the time to concentrate on our breathing to the exclusion of other matters. Most of us will breathe somewhere between 8 and 12 or so times per minute. And again, that is going to vary. Obviously, for exercise, we might be breathing more quickly. When we're asleep, we can breathe a little bit more slowly. But either way, we can do it without thinking, and that's good. There is a view, however, that if we spend a little bit of time each day focusing on our breathing, that can have a number of health benefits. And when we're meditating in particular, that's good for stress levels and for our mental health, because we're actually not thinking about that which might worry us, but we are focusing on our breathing. And we also know that the slowing down our breathing and concentrating and focusing on our breathing has some knock-on effects within the body. The breathing center in the brain is connected and fairly close to the cardiovascular or heart center. So when we slow down our breathing, we can also be often slowing down our pulse rate indirectly, and in turn that can affect and lower blood pressure. We also know that it can tip us into what's called parasympathetic versus sympathetic mode in the body. So sympathetic mode is fight or flight. So we've got adrenaline and noradrenaline and cortisol pumping out in our system because we're ready to act. Parasympathetic mode typically kicks in, for example, after we've had a meal. We're a little bit more relaxed. So interesting amalgam of studies that, and I'll put the link in the down below. 7 conditions that can be improved through breathing exercises. Now, again, I want to emphasize at the start, improved is not saying that this is the only way to go or that other treatments are therefore negated by it. No, it's saying that something as simple as breathing exercises, and essentially we're talking about slower, deep breathing, can be beneficial. So I'll go through these reasonably quickly. High blood pressure. Slow breathing can be used as an alternative non-pharmacological therapy. Researchers note that decreases in both systolic, which is the top figure. You know, when you get your blood pressure done, there's X over Y. X, the top figure is systolic, lower figure diastolic. Dropping a few millimeters of mercury on both counts, which makes sense because when we're doing some deep breathing, then we're a little bit more relaxed, and we touched on before, less adrenaline. But it appears that this may have a longer lasting effect than just at the time. Now, obviously, it needs to be done fairly regularly. Asthma, again, not surprisingly, and there have been a number of different breathing type techniques that have been recommended's too strong a term, have been sort of suggested for people with asthma to try, again, to get better control of the breathing. It's not saying that this is going to cure your asthma, but this work suggests that it might reduce the frequency of asthma attacks. Irritable bowel syndrome, again, it is a condition of the gut. We touched before on being tipped into parasympathetic mode, which is where the gut can relax, if you like, a little bit more. We also know that irritable bowel syndrome does have a connection in as much as if people are stressed or anxious, that can worsen the symptoms. So again, that deeper breathing and using the diaphragm, so that's that deeper breathing, seems to reduce frequency and severity of bouts, not a cure. Insomnia, again, not surprisingly, slow, deep breathing boosts melatonin production. Melatonin is the body's sleep hormone, and if we have a little bit more of that, that's going to help our sleep. If we do slow, deep breathing or guided meditation before going to bed or even lying in bed, you can pop some headphones on and do a guided relaxation, some focused deep breathing or meditation. Personally, I do that each night. I find it very beneficial. There are a number of apps that you can use that can be helpful. Research shows that spending 20 minutes on slow-paced breathing before bed significantly helps with the relaxation and also clears the mind. Chronic and acute pain, Once more, not saying it's a substitute for other treatments, but in the same way that if we're tense or stressed, our pain can be perceived as worse. It's not of itself making the pain worse, but it can affect perception. So if we are doing our slow, deep breathing, number one, we're putting ourselves more into that relaxed mode. We're not going to feel quite as stressed, and we're also not focusing so much on our pain. Slow, deep breathing is an alternative to other, or I probably don't like the term alternative because I think it's an addition to, promotes an active role in dealing with pain, contributing to overall well-being. Menstrual discomfort, again, a cause of pain. So once more, the deep breathing and focused breathing is going to be beneficial. Again, comment here, one 28-year-old participant in a study. True benefit came when I started breathing at the first sign of discomfort. Again, not saying that all that discomfort is going to go, but it can be helpful. And this one actually surprised me, type 2 diabetes. 2023 study examined the effect of combining aerobic exercise with slow, deep breathing and mindfulness. 6 weeks later, those who had added breathing and meditation to their exercise regimes had lower fasting blood sugar and cortisol levels compared to those who did the aerobic exercise alone. Now, I don't know how big a study this was. I don't think that, honestly, we're not going to say that this is a treatment for type 2 diabetes, but you know what? Every little bit helps. Slow, deep breathing, focused breathing, guided relaxation, diaphragmatic breathing, there's lots of different terms we can use, costs nothing. Costs nothing. You don't need any fancy equipment. You don't need anybody's permission. You certainly don't need any government programs or academics telling you what to do. So therefore, we don't hear a lot about it because there's no money in it for anybody. Bit of a theme sometime in these podcasts with the connections between useful information and lack of money behind it and therefore not getting out. And also there is a view that it just can't be as simple as that. Well, it can be as simple as that. Absolutely. Focused breathing and slow, deep breathing is not a miracle cure. But it's been shown in studies, and this is in some respects pretty intuitive, that it can be beneficial to our overall health and well-being. And even if you've got no medical conditions whatsoever, doing some meditation or focused deep breathing is very worthwhile for both, particularly for mental health, to a degree for physical health as well. So again, easy to do. You don't need any special equipment. You don't need any money. You can carve out, as little as 5 minutes, maybe 20 minutes a day would be better, but however many minutes you can carve out, you can do. Probably don't do it while you're driving, although if you are stopped at traffic lights, it can also be, it's one of those days on the roads. 3 slow, deep breaths can have a calming effect and take your mind off perhaps how you feel about some of your or other drivers on the road. But yeah, don't close your eyes and meditate while you're at the wheel, obviously. It's always good when simple things that we can do ourselves with no special equipment, with no cost involved, can be beneficial for our health. So this is something that all of us can look to incorporate in our health regime. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like, and share. You can also follow it on all the socials. There'll be new content uploaded each week.